Can sex get affected after a tuberculous spine infection? Hi, my name is Nikhil. I am here today to discuss the sexual and fertility problems after a port spine or a TB spine. Let's get started. So now we all know if we get a tuberculous infection of the spine, what eventually happens is the spinal cord getting damaged or getting injured, or the structures around it, maybe the bone, maybe the disc, all getting inflamed, and that can indirectly damage the central cord or the spinal cord. So when we talk about the sexual problems, we can consider it like, it depends upon how much injury the spinal cord has got because of this tuberculous spine. So we can divide these problems into two broad categories: the fertility related problems and the sex related problems. So what are the fertility related problems? Can any injury to the spinal cord, will it affect the fertility? The direct answer is no. Directly it will not affect the fertility, but yes, it can have some impact. In case of a female, it doesn't affect the menstrual cycle, it doesn't affect the egg production, doesn't affect the egg maturation, and in male, the sperm production, none of this is affected. But the natural fertilization will be difficult because of the poor inability to complete a sexual act in some cases. In some cases, we'll have to go for an in vitro fertilization or IVF procedures, where you have to take the egg and the sperm out, fertilize in the lab, and implant in the uterus. Some people, they will have to have it. Now, coming to the sexual problems. What all the sexual problems it can be? In males, we can say the problems can be erection dysfunctions or ejaculation dysfunction. Erection dysfunction is the sufficient amount of penile erection doesn't happen, so which is very necessary for intercourse. So when penile erection is inadequate or it's not happening, they will not be able to take part in the sexual intercourse. On top of it, the sensation also can be affected in these people. Sensation plays a major role in the act of sex. When they get a spinal cord injury of any cause, the sensations of the perineal area, sensations of the area around your reproductive organs can be less, which can cause a reduction in the arousal, which in turn affect the sexual problems. Another common problem that usually we see in male is ejaculatory dysfunction. Some people, they can have erection, but they may not be able to do an ejaculation, or they may have a retrograde ejaculation, or the semen doesn't come out. So this is the primary problem related to the males. Coming to the females, they can have two types of problems. The first problem, they may develop again a sensory problem. They don't feel enough senses where they can take part in the sex. The second thing is the pelvic floor muscles can be weak, which can lead to poor sexual intercourse. So, and on top of it, if there is a complete injury, or there is lack of sensation, whatever, the lubrication of the vagina can be a problem. This can lead to vaginal abrasions, and this can lead to sometimes vaginal tears and other problems. So this is the problems male and female, they usually face it. One common thing which is common across all the genders is the libido problems. The libido can come down because of multiple reasons. One, they may be stressed, they may be depressed, they may be upset with the injury. So this can definitely affect the libido and their anxiety that whether they will be able to perform well also can reduce the libido to a great extent. So overall, it can make the sexual life not enjoyable or not having a sexual life. So next question is there any solution? Can it be treated? Answer is yes and no. Coming to the fertility part of it, yes, fertility can be easily managed with the modern techniques of this IVF in case of a female who is having a spinal cord injury or spinal cord problem. They can have a normal, they can have a pregnancy and a normal delivery, but only thing is a very high risk, especially the pelvic floor muscles are not strong enough. It's a very high risk pregnancy. It can happen. You need to have a good gynecologist support in the process, but it is possible. And sometimes you may require to have an IVF, in vitro fertilization, to if natural methods of intercourse is not going to happen. Coming to the sexual part of it, some part it is treatable. As the sensation get better, as the motor strength get better, many people they will be able to have the act of sex in their life. Some people it may be as normal as before, or some people it may be a new normal. Like some people who develop inability to have a penile erection, some of them they use a penile implant so they can get a good erection and they can have a good sexual life. So overall there is hope. There are a lot of strategies available. So if you have any more doubts, if you need any assistance, we are there to help you. Please contact the number which is given in the description box.